going to start my timer so that I don't ramble on. Okay. First of all, thank you very much for your interest in the topic tonight. It's extremely important, and I appreciate your taking the time to come here tonight. I know the topic is the future of healthcare in Ontario, but I'd like to take you back very briefly for about a minute or so to give you the context of where we've been. I've been in practice 25 years. My career spans 4 decades, and I go back to the 80s. But if we look back to the 1970s, in the 1970s, Canada and Ontario were ranked the 4th country in the world for the number of physicians per population. We were sitting pretty. 1970s were good. By the early 80s, when I started into medical school, we were already having troubles. In fact, the talk of value that we talk about today, value for money, this is not a new concept. When I was a medical student, that was drilled into us. It was drilled into us every test we ordered. How much did the test cost? How long has the patient been in the hospital bed? We need the bed. Those issues already existed more than 20 years ago. In the 1980s, as I said, I was in medical school starting in 1982. From 85 to 89, the Liberal government was in charge. Already, we started to see doctors being blamed for costs. We were told that we churned people through, that we were seeing people needlessly. The story was there were too many doctors. But the system was under stress, and there were methods used to address that. In came the NDP in 1989. Shortly after, in a few years, Ontario was plunged into a deep recession. We struggled economically, and at that point we had built up $250 billion in debt in Ontario. Sound familiar? So we start to see trends here. The NDP hired consultants, Bear Stoddard. They had a list of ideas. One of them was to cut medical student positions and nursing student positions. Very quickly, we saw a brain drain. People started leaving. We lost our physicians. Our graduating classes were smaller. And lo and behold, costs really did not stay down. They stayed down temporarily, but then they started to rise. So the issues were, the solution that was looked for was again to blame doctors, to blame utilization. And yet we're the ones who see the patients, who know that you need care. It's not a situation where we're seeing people needlessly. We're not dragging people in off the street to see you. So then came the common sense revolution. In 1995, the provincial Tories were elected, and they focused on infrastructure. They amalgamated hospitals, closed hospitals, and they looked to solve the problems in healthcare that way. So they did get the debt under control. Things improved. And then as we emerged into 2003, the Liberals took over. Okay, and things were pretty good for a while. They spent on e-health, a couple $2 billion. You know that. Orange, you know that. OLIS, the Ontario Lab Information System, LINS. They spent because they felt they had the money. But a little bit of reality hit in 2008. We had a global economic crisis. Ontario, Canada, we're not islands. And we are affected. So lo and behold, now Ontario is a have-not province. We have over $250 billion in debt, and a deficit, depending on who you talk to, between 15 and 17 billion. So we lurch back and forth from having a surplus of doctors, too many doctors, too few doctors, and what this does is create uncertainty. We have a situation where at this point, we have 700 new doctors coming online every year for the next 4 years. And the government of Ontario has said unilaterally to the physicians of Ontario, you're going to absorb the cost of all those physicians. What do doctors do? You know, this is a situation where they start rethinking, can I afford the lease I've got? How do I manage to, take this cut in fees and keep providing service to my patients? How do I stay solvent? So now we're in a situation where orthopedic surgeons, urologists, cardiologists, oncologists are graduating from Ontario medical schools, and they can't get jobs. We have ORs that are closed, and patients lined up in the thousands, and they can't get their care. But we're graduating physicians. We're still less than the developed country average for physicians per capita. So it's not that we have a surplus of physicians, it's that we can't fund the infrastructure or the volume of services that's required. So the government says, well, you doctors, you carry that on your backs. We'll spend on e-health a couple billion, we'll spend on Orange, we'll spend on all sorts of things that there's no actual proven value for money. But when the rubber hits the road, we're going to blame you doctors. And unfortunately, what happens is doctors have to live in the real world. And unfortunately, sometimes they have to make decisions about how they can provide the services. They're asked to be able to provide some services for nothing. So the reality is we have economic pressures, we have demographic pressures, we have scientific and technological pressures. So how do we move forward in a different way, in a new way? And one of the ways is to involve frontline physicians, not academic physicians in offices and bureaucracies, but real frontline physicians who understand what the realities of practice are. But that doesn't happen. We're considered stakeholders. We're considered people who might have an interest in what happens, therefore our input is negated. That's not a way to run a healthcare system. We need a government that will listen. We need a government that's willing to deal with doctors, understand their concerns, and a public that understands how it's going to affect them, because it takes a long time to change healthcare. Thank you.